think this is good. Okay. Hello, this is my ISM research presentation. So first, here's a little bit about me. This is my family, my two brothers. Here's me and my brother again. And then here are my dogs. That's Milo and that's Lola, and I love them so much. Here's some of the places that I've traveled to. This is Chicago, Arkansas, Florida. And I just love to travel, so I thought I'd include some of those pictures up there, and I thought they were really pretty. And then this is me. I work at In-N-Out Burger. I do that in my free time. And then here's some pictures of the sunset and the beach because I also love that as well. And then I included some of the albums that I listen to because I'm a big fan of music. One of my favorite artists is Taylor Swift. And then here's some of the foods that I've cooked before because I also enjoy cooking. Okay, my quote for this year was by Terry Lively, and it was, "Each step paints a layer on the canvas to achieve the final restorative result in the patient's mouth." Now, I chose this quote because I thought it showed the connection of artistry and dentistry, which I found very cool because that's something I've gotten into this year, kind of seeing that connection, and it shows that dentistry is more than just working on the patient, but kind of painting that final picture in their mouth. So, a little bit about pediatric dentistry. So what they do is work on children 18 and below and special needs patients as well. They diagnose and handle issues with the patient's teeth, gums, and any other related part of the mouth. They provide advice and instruction on maintaining oral health. Some of the things that they do is remove decay, so like work on cavities, remove or repair damaged teeth, place sealants or whitening agents on teeth, and then they also prescribe antibiotics and medications sometimes, which the dental assistants or hygienists wouldn't do. That's just for the dentist. And they also do examine x-rays daily. Why I chose this topic and why it's important to me. So first, I knew I wanted to do pediatrics when I grew up because I love kids, so I definitely wanted to work with them. And it means being granted the opportunity to transform a child's smile, which is something that's very beautiful. And you get to also improve their confidence along the way. It's important to maintain your dental hygiene, so this is why I would like to work with children in the medical field to inform them on that and how to take care of themselves and give them that comfort that your dentist is there for. My mission statement for this year: I aim to create a loving, enjoyable, and nurturing environment where children are able to feel secure. It is my wish to provide the best dental care possible while improving smiles from infancy to adolescence. In the end, it's my passion to enhance the confidence of my patients while ensuring they get assistance in maintaining excellent oral hygiene. So this statement kind of shows what I strive to do, maybe when I have my own office when I grow up or be a dentist. And then getting into my research assessments, my first one focuses on the challenges that come with dentistry. It can be straining at times. Some of the physical strains include strains on the back since you're kind of hunched over all the time. And then it also can be mentally exhausting from the day-to-day job duties. Working with kids can be kind of frustrating at times. So you have to learn how to deal with that and adapt to different techniques to handle that. And then you're also working in a fast-paced environment and have a tight schedule most of the time, so you don't really have a lot of free time. And I also got to see that when I was shadowing my mentor. Another key thing is to be comfortable with an audience, because when you're working with children, you have their families watching you, so that can be kind of nerve-wracking. So you have to understand and learn how to deal with that and how to make sure that the parents are comfortable with you working on their kid. My second research assessment focused on some of the dental procedures and treatments that pediatric dentists perform. I looked at tooth fillings, pediatric pulp therapy, crowns, tooth extractions, and space maintainers. So tooth fillings, get filled whenever there's like decay in the teeth and you have to fill that space. Pediatric pulp therapies to kind of restore the tooth And then crowns is like a metal cap placed over the tooth to also reserve it and restore it. And then you have tooth extractions, pulling out the tooth when there's any issues in the mouth, and space maintainers, which are placed after tooth extractions. So those are some of the common ones that I looked at. And then you also have sealants and fluoride treatments, which are daily procedures that dentists do to kind of prevent cavities and stuff like that. Oh, let me go back. Okay. The third one I looked at focused on the educational prep into becoming a dentist, specifically pediatrics. So first you have to get your bachelor's degree, which is 4 years, and then dental school, which is another 4 years. And then after that, you would take your dental's admission test, which can be very nerve-wracking. There is a lot of studying that has to go into that because it's a big test, and it kind of tests your knowledge that you've had over the 4 years of dental school and also college. But they do their best to prep you with that. And then you have the National Board Dental Examinations to acquire your license. And then finally, you complete pediatric residency, which is an extra 2 years. And that differs from general dentistry just general dentistry, because with pediatrics, you're doing kids and not adults, which is more specific because you have to learn how to deal with those behaviors. And then my fourth research assessment focused on the job market. I kind of wanted to see the outlook for where it would be in a few years when I get there. So I looked at the employment rate, which is expected to grow by 4%, which is pretty good. So that's 6,000 by 2032 in the next 10 or so years. And then the openings each year were about 5,000. And then it is a pretty competitive field, which I looked at. So that is something that I had to keep in mind. My next research assessment was one of my favorites, which is where I focus on how artistry is greatly utilized in pediatric dentistry. So like I said, you're very detail-oriented and you have to learn how to be good with your hands. There are some practices on ways to get involved with that, such as practicing, just doing artistic practices like detailed painting or stuff like that. So that was definitely interesting. And then my next one focused on comparing general dentistry and pediatric dentistry. I wasn't sure exactly if I wanted to do general or pediatric. I knew I loved kids, but I wanted to see the difference between the both of them. So first, there's schooling. They have different educational levels, and like I said, pediatric has additional training, like the residency program, and they have a different work environment, which I think is what pulled me to pediatric dentistry, because their work environment is very kiddie and very fun. So I thought that was cool to play around with if I had my own office, to kind of be able to decorate that, and it's just such a fun environment for little kids to be around. And then the skill level. My last research assessment focused on the cosmetics of dentistry and how that can affect one's confidence. So I read about something called an approachable smile, which was that I think everyone has a beautiful smile personally, but physically there is something called an approachable smile, which is just cosmetically more beautiful. So dentists focus on getting you to that point where you have an approachable smile, and they overall just want to make you feel confident and boost your self-esteem, which can also boost your well-being. There's also cosmetic dental surgeries and procedures such as braces, whitening, veneers, dentures, and dental caps. And then I looked into how physical appearance affects your mental health. Next, into my interview assessments. My first interview was with Dr. Tran. He's a pediatric dentist at Pebble Path, and he works strictly on children. And he previously worked as a dental assistant and did volunteer dentistry and shadowing on dentists, which is really good if you do want to be a dentist. It's good to get shadowing hours in with this field. He also discussed the reward of growing up with the patient from infancy to adolescence, which I think is a very beautiful thing. You kind of get to watch them grow and get to know them as a person, not just have them as a patient. And then he also discussed the importance of finding out if you have a true passion for the field rather than going into it for the money or something like that. He said that this is a very important thing and you don't want to go into it just for the money or anything like that and then find out that you don't have a true passion for it, because it takes someone with a true passion to go into the field. My second interview assessment was with Dr. Andrew Ken. He is a general dentist for Little Big Smiles Dentistry. He works with children and adults. So he told me that he does staffing 60% of the time and clinical work 40% of the time. He shared his show, tell, then do method, which really stuck out to me. So first, whenever kids would get nervous or anything like that, he would first show them what he's gonna do on them, then tell them, and then do it. And he also mentioned that this typically could take a few different appointments, because if a kid is to that point where they're really in a high stress, then it takes a few appointments to get them to that point where you can actually perform the procedure on them. He also previously tutored DAT students, which I found really cool. And he graduated from the University of Pennsylvania, and he discussed tactics to help patients feel comfortable, such as the show, tell, do method. My third interview assessment was with Samantha Salig. She's a program coordinator for a medical grant at Dallas County Health and Human Services. So she talked to me about how she mainly sorts through autopsy reports and identifies any issues. She mentioned that it's rewarding to complete many cases, which I thought was a really cool thing. And she previously worked as a medical ICU nurse and also did side home health jobs and vaccine clinics, so she's done it all. And she graduated from Texas Tech, and she also stressed that organizational skills are vital when coming into the field. My fourth interview assessment was with Mary Markarian. She's an infection preventionist at Baylor McKinney Hospital. She decreases infections in patients, so doing surveillance and checking IVs. She spends 1/3 of her time doing computer work, 1/3 doing having interactions, and then the rest doing investigative work. And the rest of her time goes to making emails and phone calls. She also previously worked as a labor and delivery nurse, so I got to hear her story about that, which is really cool. And she discussed how being a detail-oriented is very important. So this is my mentor, Dr. Andrew Ken. He is a general dentist at Little Big Smiles. He went to the University of Pennsylvania, like I said, the School of Dental Medicine, and he earned a DMD degree. He's also worked for corporate dentistry for a few years, so he wanted to have a more personal and direct control on patients' treatment experience and quality, so decided to open his own dental office, which is really awesome that he took that initiative to do that. And he started Little Big Smiles Family Dentistry, and it's been up and running since 2014, and he's been providing good quality dental care to the surrounding community ever since. He's also done charity work, which is Give Kids a Smile Days, and he's married with 2 grade school daughters, which is super cute. And then for my product, I decided to look into oral diseases and prevention for them, because I thought this was a very important thing, especially to know like pre-college and pre-dental school, just to kind of get an idea of what I'm going to be working with in the future. So first I looked into cavities, which is the big one that we all know, it's super common in kids. So they are decay in the teeth, which can form holes in the teeth depending on how bad they get, which result from the breakdown of tooth enamel, which is the hard outer surface of a tooth. 40% of children ages 2 to 11 develop cavities in their baby teeth, and 21% of children 6 to 11 develop them in their permanent teeth, which I thought was a pretty big percentage. So dentists work on decreasing that by using things like sealants and fluoride to kind of make sure that kids' teeth stay protected. Some of the symptoms for cavities include white spots in the infected area, light brown coloring, pain in the area, and sensitivity to certain foods. So there's different types of cavities, such as root cavities, pit and fissure cavities, and smooth surface cavities. So root cavities occur when they form on the root surfaces of the teeth, although they're mostly common in adults, they do occur in children as well. So to treat them, dentists remove any decay and then fill the cavity with a tooth filling. And if it's spread to the pulp, root canal therapy is usually needed for that. The next one is pit and fissure cavities, which are areas decay in the narrow grooves of the teeth, and they can be treated with sealants or fluoride, so that's more of an easygoing one since they're kind of at the top of the tooth. And then smooth surface cavities, they are slow growing cavities on the flat, smooth surfaces of teeth, usually on the sides of the mouth, and these are also easier to treat as well with fluoride. It's important to know the preventative measures for cavities, especially when it comes to your oral health in general. They are caused by the interaction of bacteria and sugars in the mouth and also poor hygiene. So parents do play a big role in helping prevent cavities in children. So I wanted to look into that since it's pediatric dentistry. Kids do need help brushing their teeth until they're 6 years old. They also need to be flossing regularly, eating a well-balanced diet, so not a ton of junk food, and then having routine dental cleanings at the office, and also avoiding bacteria spreading, so not like putting your fingers in your mouth to ensure that you don't get a cavity. And then I included a picture here of the pit and fissure cavity, smooth surface cavity, and the root cavity. So you can see here that the root cavity is more hard to reach and would be a very difficult one to get out. Next, I looked at gingivitis. It's the earliest stage of gum disease, and this is something that I wanted to look into. When I was searching about diseases, I had no idea that children could get gingivitis. I thought that was only for adults. I didn't know it was common for children to get gum diseases as well. So I looked into that, and it occurs when plaque and bacteria build up on your teeth and cause infection. The greatest increase in gingivitis in children is often seen in the 6 to 7 year age group when the permanent teeth begin to come in. There's also something known as puberty gingivitis, which I've never heard of until now. It's most common in pre-adolescent boys and girls between the ages of 11 and 13, and they're usually caused by a combination of poor oral hygiene habits and a lack in nutrients, so diet, and then teeth grinding, mouth breathing, certain medication, and medical conditions can also cause gingivitis in children. So puberty gingivitis is combined with the elevated hormone levels during puberty, which increases the sensitivity of the gums to cause something like this or to increase the chance of it happening. And some of the symptoms include bleeding and inflammation of the gums, and the gum tissue may also become red, swollen, and less firm to the touch, and bad breath can also be a symptom. So I included a picture of it here. You've probably seen this before. It is just the bleeding of the gums right there next to the tooth. The best treatment for gingivitis would actually just be preventing it. You want to make sure it doesn't happen because as children get older, it's important to make sure they maintain good oral health because they have a higher chance of it happening. They need an adult's help with brushing their teeth until age 6, like I said. Some kids, in different cases, they need help with brushing their teeth and maintaining oral care until a little bit older, such as special needs patients. If a child has already developed gingivitis, though, periodontal therapy at a dentist's office may help to get it under control. My next one I focused on was oral ulcers. So those are small sores on the inside of the mouth, so like the tongue or the back of the mouth, so like or the roof as well. And then they usually they're also found on the inner lip and on the cheeks. And then there's different types of them, but the most common is sores. And the exact cause of ulcers is not fully understood, but there are some factors which may cause it to happen. And they do occur in all children, but it's mostly seen in older children and teenagers, so that higher level of kids in pediatrics. And then they're usually fairly painful, so you want to make sure you're doing everything you can to prevent this for your child or for your patient. And many children will experience at least one episode of oral ulcers during their childhood, which I did not know of. That's very interesting to me. Most ulcers heal on their own, but you might get prescribed medication to help with the discomfort. And there's also ways that you can help treat ulcers fast, naturally at home. So like some home remedies would be drinking warm salt water to kind of get rid of that bacteria in there. Overall, practicing your good oral hygiene, so making sure you're brushing your teeth, rinsing your mouth, and avoiding hot and spicy foods is another one. Yeah. And they usually go away in about 10 to 14 days, so not too long. My last one I looked at was congenital defects, or known as birth defects, so cleft lip and cleft palate. They are birth defects that occur when a baby's lip or mouth do not form properly during pregnancy, and about 1 in every 1,600 babies are born with cleft lip or cleft palate in the United States. So I thought that was a pretty big statistic. I haven't really seen many people with cleft lip or cleft palate, so I thought that was cool. And it can be diagnosed as early as in the ultrasound or to after birth. So they occur between the 4th and the 7th week of pregnancy, and it occurs if that tissue does not join completely before birth in the mouth. It can be a small slit or a large opening through the lip, and it goes into the nose. It can be on both sides of the lip or in the middle of the lip, which occurs very rarely. They can also, children with cleft lip can also have a cleft palate, and that is when the tissue that makes up their roof of the mouth does not join together completely. So pretty similar, but one is more on the cosmetic side, so you can see it, and then one kind of affects your talking and breathing in the roof of the mouth. The causes are unknown. Some children get this due to a change in their genes, but there are things that the mother can do during pregnancy to kind of increase the chances of this. So like smoking, using certain medicines, and also one thing that I found interesting was when women have diabetes, that can increase the chance of having a cleft lip or a cleft palate. So this right here is the cleft palate. So you don't see it when you first look at the child's face, but once they open their mouth, you can see that the tissue did not properly form together. So some services and treatment can vary. You can do surgery for cleft lip, which is usually performed in the first few months of their life. So it's recommended within the first 12 months of life for cleft lip, and for cleft palate is with the first 18 or earlier if possible. Many children also need additional surgical procedures as they grow older, so it's not just one procedure, it also takes many as they grow up to kind of maintain that. So that will improve their breathing, hearing, and speech and language. So other types of treatments and services may be needed, such as special dental or orthodontic care or speech therapy. So I included some pictures here of different cases of that. These are kind of severe ones. I would say this one is the most common that we see in children. So thank you for listening. There's the QR code to my website. Do you have any questions?